Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Well, Tracy, we know that a diet that's filled with fruits and vegetables is good for our waistline, but it's proving to be good for our brain as well. A recent study published in the Journal of Alzheimer's Disease showed that people with normal cognitive function who followed a Mediterranean diet had lower amyloid deposits in the brain.
As we've learned before on this program, amyloid deposits in the brain are one hallmark of Alzheimer's disease. And here to discuss is the lead author of the paper, Mayo Clinic epidemiologist Dr. Maria Vasilaki. Welcome to the program.
Thank you for having me.
What's good for the body is good for the brain? Is that what we're saying?
This is what we think. There is accumulating evidence suggesting that diet has a beneficial effect for the brain too, and for against cognitive decline and dementia as well, although we don't have definite evidence for that, but there is a good body of literature supporting that.
Is that what prompted you to do the study?
Yes. In the Mayo Clinic study of aging, we are studying cognitive decline and also biomarkers of Alzheimer's disease. So one of them would be the amyloid deposition in the brain, and we had the scans and the data to study that and study the association with diet.
So when we talk about amyloid deposition in the brain, amyloid is, as I recall, it's been a while, a protein, right?
Yes.
And we knew from autopsy studies that patients who had Alzheimer's disease before they died had these deposits of amyloid for whatever reason. So there's an association between the two. And now, if I'm correct, we can actually detect those amyloid deposits on an MRI scan.
Correct. We detect them in for example, in a PET scan. So we introduce some molecules through the blood, and they go and highlight areas of amyloid deposition. So we have the scans, and we know the areas where we have elevated amyloid.
And you said that you studied people with normal cognitive function. So how do you determine if somebody's brain is normal and they can be in the study?
Yes. So our participants in the Mayo Clinic study of aging, they go a very comprehensive cognitive evaluation with 9 different neuropsychological tests, and then they are evaluated by a physician as well. We also take information by the informant, their partner, so we have a lot of information, and then by consensus, we gather all the information, and the nurse that helped, or the study coordinator, the physician, and the neuropsychologist, they decide based on data that we have whether someone would be within the normal function range, or someone would have a little more cognitive decline than we would expect for their age, or whether someone would be in the dementia area.
What was the average age of the study participants?
So for this specific study was 70 years and older. So the mean age is about 78 years old. 55% of them were men.
And what did the study show ultimately?
So we asked them about their eating habits the last 12 months. So they had to answer about 128 different questions on the food groups that they were eating, the amount, and also how often they would. And we found that the individuals that were following closer the Mediterranean diet and those that had a higher consumption of vegetables were less likely to have elevated levels of amyloid deposition in the brain. Now, we have to point out that this is a cross-sectional study in our terminology, which means this is like a photograph. We don't have the dimension of time, so we don't know what came first and what came second. So as we say in our area of research, we cannot assess the causality between the two. However, this is information that supports previous information that we know that diet has a beneficial effect. There is also the possibility that another factor could be in place that we haven't measured, that we don't know about it yet. But this is a first sign that our study showed supporting evidence of a beneficial association.
We all have talked about it, and we've talked about it on this program, but refresh our memories with regard to the Mediterranean diet. We know that it's mostly fruits and vegetables, but what can't you eat or shouldn't you eat if you're on that diet?
Why would you look at the negative part? What do you get to eat on the Mediterranean diet?
If she's right, and we don't want to become demented later in life, maybe there's something to that.
So it's a very colorful diet. It's high in the consumption of fruits and vegetables, legumes, nuts. Also, moderate to high consumption of fish, less consumption of meat and saturated fats, and more fats in terms of olive oil are consumed in the diet. Also, there is optional moderate use of alcohol as well, mainly wine, and usually it happens in social occasions.
No, wait a minute. Was wine on the list or not on the list?
Wine was on the list for the Mediterranean diet when we started studies in the 1960s. Now, alcohol is optional in a way because for some of the conditions we should not drink. It's very idiosyncratic if we cannot control the amount of wine, so it's really optional.
All right. The question is, people who have followed this diet for their entire life, people who live in the Mediterranean, I guess, do they have a lower incidence of Alzheimer's disease than we have?
So, I don't have a definite answer on that. As far as research is concerned, very rigorous clinical trials research. So we don't have definite evidence to suggest dietary interventions in our life today. We have, though, a big amount of observational data and some clinical trials that would support that good balanced diet like the Mediterranean diet, but also other diets like the DASH diet or the MIND diet that were associated with slower cognitive decline.
So I'm not familiar with either one of those. The DASH and what was the other one?
MIND.
MIND.
So the DASH diet is dietary approaches to stop hypertension. So, and the MIND is Mediterranean DASH interventions for neurodegenerative delay.
So having studied this, are you pretty much convinced that a Mediterranean diet is a good idea, not just for overall health, but also to prevent cognitive decline? Are you convinced?
I think we need to learn much more, but we have enough to follow the advice of decades now to have a good, balanced, healthy diet, and the Mediterranean diet pattern is one of them. The good thing is that although we don't have any new recommendation based on this study, and although we said it's like a cross-sectional study, it adds an additional motivation that what is good for my general health, what is good for my cardiovascular, can support my brain health. And that can happen directly, maybe through defense mechanisms, or indirectly supporting my cardiovascular system, which also would be very important for brain health and dementias.
We have 30 seconds left. What's next in your research?
So what we would like to do, and other researchers also are doing, is to follow people longitudinally, to see whether we follow the Mediterranean diet or any other beneficial diet pattern, whether changes in our biomarkers in the brain, amyloid for example, or changes in our cognition, beneficial changes are associated with a good balanced diet.
We've been discussing how diet may play a role in preventing or delaying cognitive decline and dementia with Mayo Clinic epidemiologist Dr. Maria Vasilaki. Thanks for joining us, Dr. Vasilaki.
Thank you for having me.
And that's our program for this week.